Living healthy and aging well. My name is Ken Haglund, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park, located in Eden Prairie, Minnesota. I am so grateful to be here with you today, and I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us anytime at 612-999-3426. We look forward to hearing from you. We are adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our shows on the AM 950 radio website, and we can also be found on iTunes, Spotify, SoundCloud, and many other podcast and streaming services. You can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. All right, we have another great show for you today. Joining me in a few minutes will be Jetta Wiedemeyer Bauer. She is the Manager of Volunteers and Community Outreach at Trellis, a nonprofit organization that has been serving seniors and those who care for them for nearly 28 years. We will be discussing the senior linkage line services Trellis provides and ways to access free, unbiased Medicare health insurance counseling, educational webinars on a variety of topics related to aging, the important role of volunteers in their work, and the current Medicare Advantage enrollment period. Many topics to discuss here, and of course, as some of you know, Trellis has been an innovator and thought leader in the field of aging for over 25 years and works to help people optimize well-being as they age. You will enjoy listening to my conversation with Jetta today, so please stay tuned. All right, before we begin our conversation with Jetta, I want to mention our new website has been launched, and you can find us at livinghealthyradio.com. There you can find information about upcoming guests as well as listen to my previous interviews. That's livinghealthyradio.com. All right, I want to mention we received several calls again this last week regarding our previous show with Dr. Emily Stein. She's a scientist and co-founder of Primal Health, LLC. And they are a biotech company that focuses on alleviating oral health concerns and improving the quality of life and longevity for its customers. Now, Dr. Stein on the program talked about one of their products called Daily Dental Care. Daily Dental Care lozenges contain a clinically proven formula that safely and effectively neutralizes disease-causing bacteria while strengthening the beneficial bacteria that promote dental health. These are an easy, convenient way to supplement your existing dental hygiene routine. And every bottle purchased, she donates a bottle to a senior living facility to help their residents with their dental hygiene needs. So for more information about their product, you can visit primalhealthllc.com or call them at 612-440-2011. Or you can listen to my podcast interview with Dr. Stein on the AM 950 radio station or your favorite podcast service. All right, so today you have two ways to get your questions answered. First, you can ask your question live on the air by calling the AM 950 radio station, and our friendly show producer Patrick or Adam will be getting your call on the air. To reach us on the air, that number is 952-946-6205. Once again, 952-946-6205. Or you can directly text me your question at 612-999-3426. If you missed those numbers, we'll give them out again throughout the show. And please do not wait until the show's ended to ask your questions. We often receive many of the same questions after the show has ended. So if you have a question, many others do as well. All right. I am excited to welcome my guest today. I've known her for a little while, and she's a very, very passionate person about helping others And I just love having people on the show that just have that calling. And you're going to enjoy listening to her today. Her name is Jetta Wiedemeyer Bauer. She is the manager of volunteers and community outreach at Trellis, which is a nonprofit organization. And they've been helping and serving seniors and those who care for them for over 28 years. So welcome to the show, Jetta.
Thank you so much, Ken. It's really nice to be here.
Well, this is great. And just for those folks that listen to us regularly, normally we have our guests in the studio with me, but this time we're going to have Jetta calling in. So we're very, very pleased to have her with us and to talk about Trellis and all the great work that Trellis does. But before we get into that, the audience loves to learn about you and get a sense of who is Jetta. And why don't you start with your professional background? Give us a little background of who you are and how you got to this point in your career, and also really what inspired you to pursue your life's work at Trellis.
Right. Well, thanks, Ken. It's really nice to be here, especially on this type of a day. I like to be tucked away at home. I joined the Trellis team at the beginning of the pandemic. So my original role was being charged with growing and expanding our current volunteer program. So I was also wanting to extend our reach into communities of the Twin Cities that really need to hear about the good work of the Senior Linkage Line. So in terms of my professional background, I have a master's degree in public policy. I have worked for state government, the legislative branch, and city government, but Ken, my heart has always been with nonprofit. So for the last 15 plus years, I've worked primarily in social service agencies serving infants, worked with children in foster care and adoption. I moved on to adults in drug and alcohol treatment programs, and now I have the joy of serving seniors. So I'm also a caregiver for my grandmother, which allows my work to be kind of a labor of love. And one of the reasons that I socially distance is to make sure that she is well cared for. So I do appreciate the ability to call in and share the information. So
no, that's great.
You talked about
Go ahead.
My inspiration. You know, in my family, our motto is we are built to serve. So my first memory of volunteering was as a 4-year-old little girl wearing a little pink dress. And I went with my mom to visit homebound members of our church. And my mom and my grandmother used to, they lived out their faith through service. So I know, and you know, that this is a really hard, cold world some days, and I just see my role in my professional work as kind of bringing kindness to those who might need it and to serving. So it's that kind of internal drive that led me to the world of nonprofit and led me to the world of volunteer management. And I kind of see my specialty role as building volunteer programs kind of from the ground up, or possibly fixing volunteer programs that are broken. And Trellis is kind of the perfect nonprofit organization that allows me to kind of marry my passion and my skill set under one roof.
Well, and Trellis has been doing this for decades now, and it's the perfect vehicle because I know you guys have several volunteers. Can you give us a sense for how many volunteers are a part of the Trellis organization?
Yeah, we have 80 volunteers in our organization that do a wide variety of things for us. And during pandemic, we lost some volunteers, but on the whole, we have gained them. Individuals were a little nervous at first, and they kind of held steady. And then over time, we went out and we said, hey, we'll teach you how to use technology. We'll issue you a Chromebook. We'll give you training on doing some things remotely. And folks finally started coming back saying, you know what, we want to serve too. So their roles sometimes are different. We have a lot of different roles. Some people work with Medicare and educate their neighbors on Medicare. Some of them do it on the phone. Some of them do it in person now that we're kind of opening up. We have volunteers that do marketing, like marketing committee work for us. We have folks who do presentations out in the community. We have attorneys who join us, and we have individuals who are house moms, and they're grandmothers now, and they do administrative work for us. So it's just a huge, wide range. But the general piece is folks don't want to sit idle, whether they're retired and they just want to keep busy, or we have people in their 20s who are in college doing work for us. Everyone just kind of comes to the table with their own hope and joy, and we try to make the skill set that they have come to the table with us and just work. We kind of try to be as flexible as possible.
So you're always looking for volunteers, aren't you?
Oh, my goodness, yes. Yeah. Last year in 2021, hard year for us generally in the world, but we added 22 new volunteers to the organization, which during a pandemic is crazy, and we were just thrilled about it. And of the 22, 10 of them we recruited because they spoke a language other than English. So we were trying to get at populations that don't often find Trellis or don't often seek out the services of the Senior Linkage Line. So we're bringing on individuals who speak, Spanish or Hmong or Oromo or whatnot, to try to get folks, if they are in a community where, they're absolutely speaking Spanish in their neighborhood, in their community, in the grocery store, we're trying to find volunteers that do that. But we also bring in folks who, speak English, and they're doing work on the Senior Linkage Line, taking phone calls from folks. So it doesn't matter what folks' skill set or language sets are. We're always looking to recruit folks. And typically folks are giving, 4 hours a month. So kind of 1 hour a week to try to better their community. And however we can help them to feel good about what they do, that's our joy to provide the service and the training and the support to do so.
Well, and Minnesota has such a great volunteer culture. We find that in my practice, we are required to have a volunteer portion of our services, and those are the most amazing people that volunteer their time. So we'll talk more about how people can reach you if they are interested in volunteering, but we have time for a short break here. We'll be right back to continue our conversation with Jetta Wiedemeyer Bauer. She is the Manager of Volunteers and Community Outreach at Trellis, a nonprofit organization that's been serving seniors and those who care for them for nearly 28 years. If you have a question for Jetta, please give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
Now, more than ever, we are being faced daily with the topic of human mortality, and for many people, estate planning has been top of mind. Getting your estate planning done now can be easy and cost-effective. Schroman Law offers virtual options for initial consultations so that new clients can safely initiate the process. With many facing uncertain financial situations, Schroman Law also offers affordable fees for legal documents. Learn more at schromanlaw.com. That's SCHROMEN law.com.
Fine dining, walking paths, gardens, and green space. The sound of children playing. Groups gathered to sing and paint. Prayer groups and water aerobics classes. Those are the sights and sounds that greet you at Episcopal Homes Assisted Living. Located close to Highway 280 and University Avenue, this charming community offers studio, 1- and 2-bedroom apartments. Services to help you get through your day are provided by a compassionate care team who get to know you, what you like, and your routines, just like a second family. Stay as busy as you like attending art or exercise classes, take in live performances or a movie at the theater, gather with friends at the bistro or pub, head outside and read to the children from the on-site child care. Episcopal Homes Assisted Living also offers memory care with specialized activities and support for those impacted by memory loss. Part of a continuum of care, Episcopal Homes has proudly been serving older adults for over 125 years. Check out episcopalhomes.org for more information.
The Senior Linkage Line is a free, statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide.
Welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about improving your health and quality of life. My name is Ken Haglund, and joining me today is Jetta Wiedemeyer Bauer. She is the Manager of Volunteers and Community Outreach at Trellis, a nonprofit organization that has been serving seniors and those who care for them for nearly 28 years. And we are talking about the senior linkage line services that Trellis provides and ways to access free, unbiased Medicare health insurance counseling, educational webinars on a variety of topics related to aging and the important role of volunteers in their work. And of course, we are in a current Medicare Advantage enrollment period that we'll talk about as well. So if you have any questions for Jetta, please give us a call, 952-946-6205, or you can text us your question at 612-999-3426. Jetta, if our listeners have questions or want to contact your organization, whether it be for information about senior services and resources or about volunteer opportunities, what's the best way for them to find out more information?
Well, folks, Monday through Friday, they can call the Senior Linkage Line at 800-333-2433. And any question is available. They answer millions of them, I think, every year. If folks want to learn more in terms of our website and kind of see us from behind the scenes and learn more about us and get to know us, it's trellisconnects.org, TRELLIS, trellisconnects.org.
And I was commenting with you before the program, just what a beautiful website you guys have put together here. I know you worked for about a year on putting that together, and it's just so full of information. I really encourage people to look at that, especially while we're on the air here. If you have any questions for Jetta, be sure and give us a call. And again, that's Trellis, TRELLIS, connects.org. So, all right, that's fantastic. All right, well, I do want to talk about what is Trellis, and then how does it relate to the senior linkage line? I think people have, many people, not as much people as it need to be, but many people know of the senior linkage line. That's a very popular line for people looking for resources, and as we talked about before, everything from Medicare, unbiased counseling to a whole variety of topics on aging. But what is Trellis, and how does that connect with the senior linkage line?
Yeah. Well, Trellis is a nonprofit organization, and we have been designated as the regional area agency on aging for the Twin Cities area, for the 7-county metro area. And what we do is we serve older adults. We serve people with disabilities. We serve the folks who care for our beloved elders, and also people who work in professional settings, in hospice and in assisted living and special nursing homes and such. We do our work by offering information, assistance, education, services. And every year, because we are the Area Agency on Aging, we administer the Older American Dollars Act. Older American Act allows us to funnel money, these federal funds, to the community as quickly as possible. And especially in light of the global pandemic that we've been facing, people are facing pronounced needs. And for instance, under the Older Americans Act dollars, we distributed $13 million last year to 32,000 people. And of those individuals, more than half of them were folks who were people of color. So that's one way that we serve. We also have a unit within our organization called Pension and Retirement Rights. Now, this is a program that helps our retirees reclaim lost pensions. For instance, they worked 20 years of their life, and then all of a sudden the company went belly up, right? To date, our staff and our volunteers have helped over 2,000 people recover $9 million in lost pensions. They're never really lost. It's just they think they're lost, and they come to us for help. We also have a program called Juniper, which is a network of Minnesota community-based organizations and healthcare providers. We offer evidence-based health education and wellness classes, things like diabetes prevention and living well with chronic conditions, for instance. And this last month, we are really excited to roll out a new statewide partnership called, it's addressing preventing falls, because falls are a serious threat to older adults, and they are actually the leading cause of injury. According to the CDC, 1 in 4 adults over the age of 65 fall every year. And unfortunately, Minnesota stands out. We are a particular risk. Our state ranks 4th in the country for deaths related to injury. And falls they're not inevitable, right? They're not part of normal aging. So we worked with folks at the Department of Health, the Board on Aging, the Minnesota Fire Marshals, 70 different community organizations to roll out a program called No Falls in Minnesota. It's just to help educate the community on how to prevent falls. And if folks, it's part of our website, but they can go specifically to yourjuniper.org. It's the federal agency, the Administration on Community Living, funded this effort through a grant, and we're hoping to try to prevent serious falls, any fall, and particularly the deaths that our beloved seniors are experiencing because of this. So those are some things, the retirement and the Juniper program and pension rights, Older Americans Act. These are parts of our organization. And they're internal programs. But we also have, in an umbrella relationship with the state of Minnesota, the Senior Linkage Line, which a lot of people know about. It's a free statewide service of the Minnesota Board on Aging, and they partner with Trellis as the area agency on aging. And this Senior Linkage Line helps older Minnesotans. And as I mentioned earlier, it can also help their family members or maybe neighbors that care about our seniors, professionals who work with seniors, and help us to find answers and really connect. We're kind of the liaison to services and support. So folks can call that toll-free number and ask any question related to aging. We also partner with two other organizations. One's a disability hub for folks who have disabilities, so they could be seniors with disabilities or individuals under 65, that are disabled. And we also have the veterans kind of Senior Linkage Line for veterans. So we really try to network with all of the resources that people have questions in their general life about and try to get them the information and resources to make their life a little bit better. At Trellis, our hope is that we help people age well in place, and we help folks, find dignity and grace in aging. And if we can kind of answer questions that are plaguing folks or worrying them or keeping them up at night, how am I going to afford housing, or I need to move, or I need some resources for nutrition, give us a call. That's what we do.
Yes, and I would encourage people to look at your website, because it is just chock full of information. And as you mentioned, just going under the programs tab, you've got that Juniper program there, and all the different initiatives. And you're right, falls are just one of the most difficult things for elders to deal with, because many people come onto our program after a fall, and it's just tough to recover. So, any type of prevention we can do is going to be very helpful in their quality of life. All right, the music is cueing us out here, Jetta. It's time for a short break. We'll be right back to continue our conversation with Jetta Wiedemeyer-Bauer. She is the Manager of Volunteers and Community Outreach at Trellis, a nonprofit organization that's been serving seniors and those who care for them for nearly 28 years. If you have a question for Jetta, please give us a call, 952-946-6205, or you can text us at 612-999-3426. I'm Ken Haglund, and you are listening to Living Healthy and Aging Well.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide.
The Senior Linkage Line is a free statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
Fine dining, walking paths, gardens, and green space. The sound of children playing. Groups gathered to sing and paint. Prayer groups and water aerobics classes. Those are the sights and sounds that greet you at Episcopal Homes Assisted Living. Located close to Highway 280 and University Avenue, this charming community offers studio, 1- and 2-bedroom apartments. Services to help you get through your day are provided by a compassionate care team who get to know you, what you like, and your routines, just like a second family. Stay as busy as you like attending art or exercise classes. Take in live performances or a movie at the theater. Gather with friends at the bistro or pub. Head outside and read to the children from the on-site child care. Episcopal Homes Assisted Living also offers memory care with specialized activities and support for those impacted by memory loss. Part of a continuum of care, Episcopal Homes has proudly been serving older adults for over 125 years. Check out episcopalhomes.org for more information.
Now, more than ever, we are being faced daily with the topic of human mortality. And for many people, estate planning has been top of mind. Getting your estate planning done now can be easy and cost-effective. Schroman Law offers virtual options for initial consultations so that new clients can safely initiate the process. With many facing uncertain financial situations, Schroman Law also offers affordable fees for legal documents. Learn more at schromanlaw.com. That's SCHROMEN law.com.
All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about improving your health and quality of life. My name is Ken Haglund, and joining me today is Jetta Wiedemeyer Bauer. She is the Manager of Volunteers and Community Outreach at Trellis, a nonprofit organization that has been serving seniors and those who care for them for nearly 28 years. And we are talking about the Senior Linkage Line services that Trellis provides and ways to access free, unbiased Medicare health insurance counseling, educational webinars on a variety of topics related to aging, and the important role of volunteers in their work. And we'll also talk about the current Medicare Advantage enrollment period, this segment or the last segment of the show. So if you have any questions for Jetta, this is a great opportunity to ask your questions about concerns you have regarding elder concerns, elder issues. You can give us a call, 952-946-6205, or you can text me your question at 612-999-3426. All right, before we return to our conversation with Jetta, I want to mention this program is brought to you each week by Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with innovative and comprehensive end-of-life health care. The team at Minnesota Hospice has been helping patients and family members with award-winning end-of-life healthcare services. Please do not wait to learn how hospice care can benefit you and your loved ones. Hospice brings compassionate medical, social, emotional, and spiritual services to your home with no cost to you or your family. If you have any questions regarding end-of-life care or support, please contact the caring team of experts at Minnesota Hospice. They are available 24 hours a day, 7 days a week. Their phone number is 952-898-1022. Once again, that number is 952-898-1022. Or visit them online at minnesotahospice.com. All right, Jetta, we're back, and if listeners have questions for you or your organization, or they want to look into maybe some volunteer opportunities, what are the best ways for them to get a hold of you guys?
You know, during the week, it's our 800 number. So 800-333-2433 is the Senior Linkage Line. If they want to learn more about Trellis and volunteering or Medicare open enrollment periods and such, it's trellisconnects.org.
Mm-hmm. Yeah, and that's TRELLIS. TRELLIS, trellisconnects.org. Don't put the .com on there. It's .org. And it's a beautiful website. Lots of great information here. And again, you have people staffing phones all week long, so people can just call in with their question, right? And they'll find somebody that can help answer their question.
Yeah. You know, we have individuals who call for themselves, but we also have individuals who call for their parents. You know, we had a daughter call on, the mother's name was Sarah, and Sarah had just had a fall, unfortunately, and she had to have a surgery as a result, so she kind of went into assisted living, and she was kind of backing herself back into home because she wanted to live at home, and her daughter was out of state and gave us a call, and what she really needed to do to be safe in her home was a little bit of assistance and some chore services, so she called the Senior Linkage Line, and we were able to make a referral to a company or a couple companies. She chose the one that fit her lifestyle, and her mother wanted to get on a chair and dust, right? We don't need to be doing that after surgery. And so we were able to help, Sarah's daughter feel some peace of mind knowing that her mother was well cared for. We work with people, we work with the Older Americans Act dollars. We have nutrition services. During the pandemic, a lot of our seniors were not getting out of their homes, and particularly for communities of color who had really specific dietary needs, they would call the Senior Linkage Line and say, we need halal meals, or we need kosher meals, or we need something, and they have to be delivered, right? Because no one's getting out because of COVID. So we have the ability to go into one of our databases. It's Minnesota Help Tip Info. Individuals from the public can go right to that website. They can get it from our website, Trellis Connects, or they can go to minnesotahelp.info. There are 40,000 resources in this. You can search the entire state of Minnesota, things that are not just related to seniors, but it might be related to retirees, people with disabilities, people experiencing homelessness. We've just got a lot of opportunities in here: unemployment, veterans, waiver services, youth. And folks go there, and if they were really overwhelmed with technology, give us a call. We will do all the searching for you and help find, if you're in, a zip code in the North Metro, we will do a zip sort and see if we can find chore services or nutrition services or any type of thing that's going to make your life a little bit better. Or, you can do it yourself and you can sort it. I was on the line the other day, and it was a food shelf group, and they said, well, we serve folks who speak another language, and we get stuck. And I said, don't worry about it. At the top of this MinnesotaHelp.info, you can hit select languages, and there are tons of different languages. I'm looking at it right now, and you can choose Spanish, Tahar, Sindhi, Persian, Malay, languages I didn't even know existed, and you can turn the entire website into Spanish or the entire website into Arabic, and then someone who's in their home language can find these resources and really feel good about it. Because what we try to do, again, is to try to help people. So whether it's Medicare and providing that free, unbiased, counseling on how to pick the right Medicare plan, or doing cost comparisons, or maybe it's trying to find an educational presentation. Someone is going to retire and they want to know about healthcare directives, or they want to know about consumer and healthcare fraud. We provide free presentations throughout the metro, and we do it in person, and we do it by virtual, we do it hybrid. However someone needs that information, we can provide it. Because people, when they get nervous about life and they've had a fall, or they have a parent that they're worried about, or a grandparent, they don't want to worry about where to find information. And the most important thing for us is that this is a free service. You never have to pay for the information we provide. It's objective, meaning that we don't recommend one service or the other. We might look at your zip code and find 6 different services and then send you that information, and then let's talk about what's the best choice for you. That's kind of the beauty of the Senior Linkage Line. During the Medicare open enrollment period, you always find these folks who are retired football players or sports figures, and people are like, wow, I didn't know that a quarterback could give that information. Like, yep, they can read a script, and we always laugh about that. Like, I don't know how they're able to give that information, but they're getting paid for their sponsorship. So the nice thing about Senior Linkage Line is we are not insurance agents. We are not brokers. We don't, get paid to throw a football. We get, paid just daily salary to help people make good choices so they can live with grace and dignity and honor, whether it's for themselves or their grandparents. And that's kind of the thing that at the end of the day, we kind of pride ourselves on.
Now, we've talked about, and you've talked about, this is a Twin Cities metro area of support area.
Yeah.
But it's statewide, though, too.
Trellis is a nonprofit, right?
Yeah.
We cover the Twin Cities, but pension rights, we serve 6 states, right? Iowa, Dakotas, Wisconsin, Nebraska. In the Senior Linkage Line, if Duluth gets a call from, up north in the cities and they're busy, that call rolls to us, and so we answer. So it doesn't matter if you're living in Duluth or Delano, anywhere in the state, we can provide services. So if you happen to be in the Twin Cities listening to the radio station, but your auntie lives up in Ely, give us a call. We'll be able to refer things just as easily from our database of 40,000 services to someone that's just in my neighborhood here in the South Metro.
Yeah, the number 40,000 almost overwhelms, I think, me and other people. That's a lot of resources that people can tap into that you guys can help them with. I mean, that is almost overwhelming, I think, for a person to say, wow, how would I even find what I'm looking for?
Yeah, Minnesotans are kind of humble. I was talking to our data management person last week, and she said, yeah, it's kind of closer to 60,000. I'm like, yeah, okay. It's kind of like, the 10,000 lakes, and Minnesota has 11,000. We're just humble people.
Yeah, that's
but
true.
The more information and resources we have to give out, the better lives people lead. The safer, the more joy, the more freedom that people have to live in their home communities as long as they want to. Or maybe they want to go to a community living where it's all seniors over 55. We just have the ability at the touch of a keyboard right now to find those resources, and that's our joy. We have all these beloved elders in our lives, and it's our responsibility, but it's our joy to try to serve them in the best ways that we can, and that's kind of the earmark of Trellis, is being able to assist individuals to age successfully, but also to help develop the capacity of communities to care for our beloved seniors.
Mm-hmm. And that is an honor that many of us take very seriously. I had the Minnesota Demographic Center on a while back, and they said that there's over 600,000 unpaid people taking care of elderly people in Minnesota. It's a huge need, and I know families when they come to us, they're struggling to try to find, how do we help keep my loved one, my parent, my grandparent as independent as they can, because people do want to stay in their home that they've known for decades. And it's sometimes tough to know, what resources are out there, and when you go online and just start searching for things, it can be very confusing.
Yeah. Sometimes you just want to go somewhere where you trust, and Ken, for us in the state of Minnesota, there's almost 900,000 older adults, 65 or older, living in our entire state. Yeah. 72% of them live in the Twin Cities. So we have, almost 650,000 older folks living in the Twin Cities. And so it's always important for us to know where to help them. And again, it's the granddaughter who calls, it's the adult child that calls, it's the neighbor that calls, it's the person who lives at the skilled nursing facility saying, I need a pre-admission screening code to get this person into the living facility. Just, at any given day, that person on the line, you have no idea what kind of calls are going to come in. And people are frantic now. It may be a very low need, can you do a zip sort for chore services in my neighborhood? Or it can be, I really am fearful for my neighbor next door. They've fallen and I can't get help. Can you assist? So it's any given day, it's kind of a fun. And our volunteers get to help with that. Some of them are on the phone line, and some of them are in the community providing coaching and counseling on Medicare services. Right now we're in Medicare Advantage open enrollment. It goes to the end of March, and our volunteers are right out there on the front lines helping people make these decisions just by information. Again, at the end of the day, it's not my money. It's our consumers' money. We just want to make them or have them make good decisions so that they feel really like, look, I knocked this one out the park. Check mark. I made a great decision about my plan, because Medicare is complicated and there's no need for that. We have a ton of staff on the line. We have 24 volunteers who can meet people out in the community to do that kind of counseling. They can talk to them on the phone if they feel better, because, Medicare, you got Plan A, Part B, Part C, Part D. It is alphabet soup. And, if people on the line are thinking, well, I can spell Medicare, that's about all I got in my back pocket, good deal.
Yeah, right.
Our volunteers can kind of gently guide people through that decision-making process.
And you must have a nice training program for the volunteers to learn all these resources and learn about Medicare.
Oh my gosh, I have two of the best volunteer coordinators in the entire state. They are fantastic.
Oh, that's good. All right. Well, it's time for a short break. We'll be right back to continue our conversation with Jetta Wiedemeyer Bauer. She is the manager of volunteers and community outreach at Trellis, a nonprofit organization that's been serving seniors and those who care for them for nearly 28 years. And we've been talking about the senior linkage line services. So if you have a question for Jetta, please give us a call. We have one more segment left, folks. You can reach us at 952-946-6205, or you can text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
Fine dining, walking paths, gardens, and green space. The sound of children playing. Groups gathered to sing and paint. Prayer groups and water aerobics classes. Those are the sights and sounds that greet you at Episcopal Homes Assisted Living. Located close to Highway 280 and University Avenue, this charming community offers studio, 1- and 2-bedroom apartments, Services to help you get through your day are provided by a compassionate care team who get to know you, what you like, and your routines, just like a second family. Stay as busy as you like attending art or exercise classes. Take in live performances or a movie at the theater. Gather with friends at the bistro or pub. Head outside and read to the children from the on-site childcare. Episcopal Homes Assisted Living also offers memory care with specialized activities and support for those impacted by memory loss. Part of a continuum of care, Episcopal Homes has proudly been serving older adults for over 125 years. Check out episcopalhomes.org for more information.
Now, more than ever, we are being faced daily with the topic of human mortality. And for many people, estate planning has been top of mind. Getting your estate planning done now can be easy and cost-effective. Schroman Law offers virtual options for initial consultations so that new clients can safely initiate the process. With many facing uncertain financial situations, Schroman Law also offers affordable fees for legal documents. Learn more at schromanlaw.com. That's SCHROMEN law.com.
SeniorCommunities.guide is your free online website to find housing, care, and resources for seniors in Minnesota. Use the powerful, award-winning search tool to quickly improve your search. You will have all the information you need to contact providers directly without any hassle. Start your search now at SeniorCommunities.guide and follow us on Facebook for interesting articles, helpful advice, and how older adults are changing the world.
SeniorCommunities.guide.
The Senior Linkage Line is a free, statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about improving your health and quality of life. My name is Ken Haglund, and joining me today is Jetta Wiedemeyer Bauer. She is the Manager of Volunteers and Community Outreach at Trellis, and as you can tell, she is very passionate about what she does. Now, Trellis is a nonprofit organization that has been serving seniors and those who care for them for nearly 28 years. And we've been talking about the Senior Linkage Line services, and we're going to talk a little bit now here about the Medicare eligibility for seniors. We've only got one more segment left here. We want to make sure you understand just the great resources that are available at Trellis. So Jetta, how can our listeners connect with your organization?
Well, folks can call us at any time and ask any question. And don't worry about how silly the question is or how robust it is. We answer everything from nuts to soup. 800-333-2433. And right now, we're in the month of March, and from January 1st to March 31st is the Medicare Advantage open enrollment period. And we need to talk about that simply because you have an opportunity. If listeners currently have a Medicare Advantage plan, and for whatever reason you're thinking, I don't like this plan, I need to get out of this plan, you can do that. You can change to another Medicare Advantage plan with the same company. You can change to a Medicare Advantage plan with another company, a new one, or maybe you just want to go back to original Medicare with a separate Part D. You know, we talk to consumers all the time. We talked to a guy named Bob, and Bob signed up last year for whatever particular program it was, that he had, his Medicare Advantage plan, and January, this year, January, he had a surgery and something wasn't covered that he needed covered, and he just didn't feel comfortable. He had an Advantage plan, and so he gave us a ring and talked to one of our staff on the line, and they helped him kind of look at all of his options and pick, 2 or 3 that were right for him. It doesn't matter why folks want to choose. It's your right as having an Advantage plan to make the change between January 1st and March 31st. The neat thing is that it doesn't matter how complicated you think it is. We have folks, and they do this all day long. No one can ever be a true expert on Medicare, but if we don't know the answer, we're going to find the answer to what's going on. And the neat thing and it's free. You know,
Right.
We don't charge anything for our services. We'll provide all the information, whether you work with one of our volunteers. You know, we have 27 sites throughout the metro, and we staff that. Folks can go to the website, and they can look and they can do a zip search, trellisconnects.org, under Get Help, and you can go to Medicare. You can do the appointment online, and so you can have a phone call with someone to do the appointment. You can go to one of these 27 sites in the community and meet with someone eyeball to eyeball. And these are just volunteers. You know, these are folks who say, I want to learn more about Medicare. We had a volunteer come up in the last couple of months, and I was asking her why. You know, why did you want to do this? And Jill said, I'm retiring. I don't want my brain to get foggy. I want to learn something new. I have no idea about Medicare, but I want to learn something new. And we said, all the power to you. We're going to put you some training, give you some resources, and put you in a place where we've got several months of training until you really feel comfortable. And that's just one type of our volunteer that works with Medicare. We have folks that do marketing for us. They do presentations. They do public speaking. We have a volunteer that helps us with radio things. Whatever kind of a skill set someone has, if you want to find ways to give back to your community and you've got a couple hours, you could do it everything by phone. You could do things electronically with us. You could do things in person. You could go to community centers. We know that one of the most important things for someone who's retiring and going into those golden years is to find purpose and to find passion and feel like you're giving back to the world. You know, if folks want to learn a little bit more about Trellis, we would love to have you. We have 80 volunteers right now, and my goal for this year is to grow to 100. Not because that's any cool number. It's just that the more time we have with people to feel great about what they're doing in their community, that's how we give back. You know, that's how we allow them to serve. And like I said at the top of the hour, I'm built to serve, and we want to bring other people along with us to do the same thing.
Well, there's a growing need, so I can see how you could easily have 100 volunteers and still not be able to cover everything you want. So that's great. I encourage people. I tell you, the one thing that I have seen in our organization that we serve seniors, and many times we serve the patients that we have, their children are seniors as well. And one thing we have found over and over again, they're just so grateful for the help. It's just, I don't know what it is. It's something that maybe comes with age, but the gratitude and the gratefulness and the appreciation for any help that people do for our senior communities is just what makes it so worthwhile, makes it so rewarding for us and our team and you and your team. So I would really encourage people they're looking for those volunteer opportunities. What a great organization to connect with.
Yeah, we kind of help people pay it forward. You know, no one gets in the place where they are in their world alone. So if you're in a place where you're thinking, I need to give back, or I want to learn something new, or I want to try something new, or maybe I just want to meet more people. My social network needs to grow a little bit, and I need, a couple more folks. We would be glad to have folks. We have a page. It's trellisconnects.org. At the top, it says volunteer. Folks can learn more about us. They can ask questions. They can apply online. And sometimes it's a great fit, and sometimes it's not. And we just have a real nice conversation, and people put in an application, and about 2 days later they're going to get a call back. We'll schedule an interview, and like I said, some people are still socially distancing. That's okay. We can do everything virtually with folks now, whether it's a phone call. We have a volunteer role called volunteer ambassador. This is someone who maybe you are part of a library or an auto club or the Kiwanis Club or whatever club, and you are around a lot of seniors. We want to talk to you because we're going to put information in your hand. You're going to be the most intelligent person in the room about senior services. And all you have to do is tell people, oh, here's a flyer. Here's some information. Here's a website. Yeah. And you have the ability to help out seniors around you doing something as simple as, a 1.5 hour call every month, grabbing new information to serve those around you. So it's just a really easy way to ease into volunteering. You don't have to go from 0 to 60 and do Medicare enrollment calls. Right. And there's a lot of roles to fit everyone's lifestyle.
Well, and I was just going through your website under Get Help, under upcoming presentations. You've got several presentations of really great topics that people can sign up for.
Yeah. Everyone needs a healthcare directive. Everyone needs to learn more about fraud and scams. There are so many scams around COVID right now. And what these folks do is they target our older folks. They target our beloved elders. So we do a workshop, teaching people what's going to happen and how to prevent it, but also if it happens, how to report it. we have folks in that website, that 40,000 plus resources. We can do a short presentation, 30 minutes, and teach people how to use that resource and show them where that's at. So we help our colleagues in the Juniper program with fall prevention. So it just we have classes on dementia and how to make a dementia-friendly neighborhood where you're at. Seriously, if there's anything about seniors and growing old and with dignity that folks want to learn about, TrellisConnects.org is the place to go.
All right. We are nearing the end of the show, and I want to thank Jetta Wiedemeyer Bauer. She's the Manager of Volunteers and Community Outreach at Trellis. And Jetta, how can people reach you one more time?
800-333-2433. They can go to TrellisConnects.org to reach us and find the website. And we would love to start the conversation. Whether you're calling on behalf of yourself, a neighbor, a relative, or you just want to volunteer, any call is a good call.
All right. Thank you so much for joining us, Jetta. We hope you enjoyed today's show. Please join us again next Saturday at noon for another live broadcast. And thank you for listening to Living Healthy and Aging Well, where we talk about your health, your life, and until next time, choose to live well.